Hi guys, welcome back to my YouTube channel. I am Dr. Sidra Osman. In this video, we will be talking about a very important examination, and that is UPSC CMS, UPSC Combined Medical Service Examination. A lot of you have asked me the questions about the UPSC CMS strategy. This is the way I approach the theory exam, and in this video, I'll be talking about that. So guys, a brief introduction about the examination. It is conducted by UPSC, Union Public Service Commission, for Group A and Group B officers. For departments like Railway, CGHS and Municipal Department, you get posted in these departments. There are around 800 vacancies, and this examination is a national level based examination, and it is conducted in offline mode. That is, you get OMR sheets for it. Now the eligibility criteria is if you are in MBBS final year or if you are an intern or post intern, you are eligible to give the exam. Now the fees detail for the application form. For women, OBC, SC, ST, there is no fees to give the examination. For general, it is around 200 rupees. Now the timeline for this examination. So the forms are released around March or April, and the examination is conducted in July, and after 20-30 days you get your result. Then after that around 300 students are selected, and out of which you are supposed to give a personality test, and then the final list comes out. So this is how the timeline works. This is a two-step exam. The first, the theory exam, and then you have your personality test. The theory exam is of 500 marks and the personality test is of 100 marks. Now the theory test is a MCQ based exam, and you have two papers for it. The first is of medicine and pediatrics, which has 120 questions, and the next paper is of surgery, OBGY and PSM, which contains 40 questions each, and then the total is 120 questions. So the total is 240 questions and you get 500 marks for it, right? Between the two exams you have a 2-hour gap. So the pattern for the exam. So it is an offline based exam, and you have OMR sheets for it. So the first thing is there are no image based questions, so you don't have to practice image based questions for the examination. Now the next thing is the multiple choice questions are asked more than the single choice questions. Like in most of the cases there are, like, you get 4 options and 3 options are correct and you have to find the incorrect one. So multiple choice questions dominate this examination. Another important thing is time management. You have 120 questions in the first set and you have 120 minutes for it. So you have 1 minute for each question, then you have a 2-hour gap, then another 120 questions and 120 minutes. So basically 1 minute for each question. Also, some of the time goes in filling up the OMR sheet, and in between the people come for signatures and everything. So a little time goes in that also. So you have to manage your time accordingly. So we have 240 questions and 500 marks. So for every correct response we get 2.08 marks, and for every incorrect response we get a minus 0.7. So you need to decrease the negative, right? According to data in general category in 2024, the cutoff after theory examination for general category, it was 309 marks out of 500, and after the personality test the final cutoff was 403 out of 600 marks. So I have analyzed the list of personality test, and on an average people are getting 50 to 60 marks in the personality test. So the strategy should be you should score more in the theory exam, so that because the personality test people are getting less marks. So the thing is you should score more in the theory exam to get a good seat. Syllabus of examination. On your screen you will see the syllabus published by UPSC. Now in paper 1 medicine and pediatrics come. From medicine 90 questions are asked, and from pediatrics you get 30 questions. Now from medicine, pure medicine plus some of the allied subjects are also asked, like from you get 2 to 3 questions from dermatology as well, and 2 to 3 questions from psychiatry also. The options are like that. For that you need to have some knowledge of microbiology and pathology as well, so you can solve the question, although it is very easy. You can easily approach it, right? Now the next thing is for pediatrics. For general medicine you can refer to any of the coaching notes that you are using. It will work for you, but you have to study dermat and psyche also. For some part, for important topics you have to read that. So for pediatrics you get 30 questions, and according to me I think the pediatrics that is asked in UPSC CMS, it is a little tricky. So for that you need to refer to main notes, and you also need to have a OP Ghai book for that, and you need to refer some of the part like feeding and everything from OP Ghai also. Now on your screen you will be seeing the syllabus for surgery and OBGY as well. I'll put up the syllabus link in the description. Now what should be the plan of approaching these subjects? So the first thing is you need to identify high weighted subjects. So if you are covering general medicine, OBGY and PSM, these are very high weighted subjects. They can easily give you 60 to 70% questions are from these subjects only, and the questions that are asked that are also very approachable and they are kind of doable also. So these are value for your time, and you can easily score well in these three subjects. Then the next important thing is using standard textbooks. So for two subjects I would suggest you to use standard textbooks. For pediatrics please refer to OP Ghai, and for PSM use Park, or if not Park you can also refer to Vivek Jain also, but I would personally suggest using Park for PSM. Then the next thing is the rest of the subjects can be covered from any of the coaching notes, but for these two subjects please refer to your standard book. If you are in final year and you are aiming for UPSC CMS, so this is how you should approach the subjects. So for medicine please refer to your main notes. Medicine is asked in a little depth, so please refer to your main notes for medicine. Then you also need to refer to rapid revision for derma, rapid revision for psyche, patho and micro as well. For these four subjects please do the rapid revision if you are not, I know because you do not have much time in final year as well. So for these four subjects please do the rapid revision video. Now for pedia you need to do the main notes, and also you need to add all the important topics and all the important information from OP Ghai, because the important topics like nutrition, growth and development are asked in a little depth in UPSC CMS. Then next thing is for PSM you need to do the main notes, and because you have a time crunch in final year as well, so you can also do the rapid revision notes. Rapid revision notes work fine, no need to worry about that. For surgery and OBGY, do the main notes of any coaching and it will work fine for you. If you are an intern or post intern, then whatever you are reading for your NEET PG and INICT, the UPSC CMS will be easily covered in that. You can check out the important topics from other resources from main notes as well, but as such you don't need to do anything else. Your rapid revision notes or anything else will cover all your UPSC CMS syllabus. But for pediatrics I would suggest you to please do it from the main notes. UPSC CMS is a MCQ based examination, and you cannot ace an MCQ exam without practicing the MCQs. So for the mock test you can use some resources. The best is to use the past previous year papers for UPSC CMS. You can find those papers easily on Telegram, or you can find them on the official website for UPSC as well. Download the papers from there and practice the MCQs as much as you can. You will get an idea what kinds of questions are asked and what is the pattern of the examination. Then if you want to check out some platforms, you can use PrepLadder, Unacademy, Diksha, and there's one book that is Mudit Khanna CMS Review. You can use that also. Now this is the list of very important topics for the examination. So for medicine you need to do, in cardio you have to do acute rheumatic fever, very important. 2 to 3 questions are fixed from this topic. Endocarditis, metal stenosis, hypertension, heart failure. In renal you have to do electrolyte imbalance, especially hyperkalemia. 5 to 6 questions were directly from hyperkalemia. Then chronic kidney disease and acute kidney injury. In neuro, stroke, seizures, very important, meningitis. Pedia you have to do NIS, growth and development, nutrition and newborn care. For nutrition and growth and development please refer to OP Ghai. Then for OBGY you have to do postpartum hemorrhage, PIH, preeclampsia and eclampsia, very important. Cervical cancer, and cervical cancer is very important. Staging is asked in the exam, every year it is asked, so you have to cover cervical cancer. Then labor and contraception. PSM is super high yield. For that you need to do epidemiology formulas, screening, national health programs and cold chain. Epidemiology and screening is very high yield. For derma, infections are mostly asked, so for that you need to cover infections part from derma. Rapid revision videos work fine for dermat. Then next is psyche. In psyche, delirium, tremens, depression, schizophrenia, these are important topics, so you have to cover them. Then in anesthesia, basic questions are asked like Mallampati scoring, muscle relaxant, these are the kind of questions. Anesthesia, you get 1 to 2 questions from ENT and ophthal as well, but they are not very high yield, so you can leave the subjects as well. So important topic PDF, I will put up the link in the description, you can check it out. Now the question arises, should we go for NEET PG or UPSC CMS? So here are some pros and cons for each of them. and this is a very subjective question. It depends on what do you want in your life. The first thing is pros of UPSC. That is, first thing is you get early settlement, you have a very good work-life balance, then there is a very decent pay. One more important pro for UPSC CMS is that you get sponsored seats, that is after serving for a certain period. It depends on your DAF and your cadre for what amount of period you have to serve. You get sponsored seats in central institutes like AIMS and JIPMER. So you get to do a PG from these reputed institutes if you are a UPSC CMS servant, right? Then the cons for UPSC CMS. So if you want to do post graduation and you already have a dream branch, then NEET PG and NICT is always a better option for you. Then another con is that you have a plateau in growth. Then another thing is that it is an administrative job more than a healthcare job. So it may be a pro and con depending on what do you want in life. So if you are looking for an administrative kind of job, then UPSC CMS is a win-win for you. But if you are not looking for that kind of a job, you want to do post graduation, then NEET PG and NICT are better options for you. Hope you found this video helpful. I'll put up all the important links in the description, like the UPSC CMS important PYT list and the syllabus for the exam. Till then, keep preparing and all the best for the exam. See you in the next video.